Hi, so this is the 8th and the last video in our series on function-based behavior intervention. I'm Dr. Shepard, and this time we're talking about kind of wrapping it all up and the components of a written behavior plan. So there are several essential components of a written behavior plan. Now, if you're in the school or if you're in a professional setting, you definitely want a written behavior plan and you want to write things out. If you are at home, it's always a great idea, especially with your older kiddos, to have something in writing. So we talked about a couple of videos back in this series about kind of teaching the expectations, and whenever things change, it's important to explain that to others, especially the child. So if you have a child who's, I would say, 10 or up, it's a great idea to have a written behavior plan that just says it's kind of a contract. But it's also important if there are multiple people working with your child, especially if your child has a disability, and maybe you have multiple providers coming into the home, or maybe it's you and your husband and grandma or grandpa, or aunts, uncles, sisters are also helping. It's a good idea to have everything in writing, just so everybody's doing things the same way, because if a child has a disability and one person's doing things one way and one person's doing things another way, or maybe things are happening one way with their paraprofessional and another way with their teacher, or one way with mom and another way with dad, then it gets very overwhelming for the child to learn the new behavior and to really get rid of those undesired, unwanted behaviors. So if you put it in writing, it's a great idea. So what you want to do is you want to formalize or write out, what is the behavior that we want to reduce? What is that challenging behavior? What is the behavior that we're targeting? Is that tantrum behavior? Is that aggression? Is that the eye roll and the sigh that girls tend to have with the attitude? Is it talking back? So what is that behavior that we're looking at reducing? Is it non-compliance? Is it arguing, negotiation? What is the replacement behavior? What is it that we want them to do instead? So if it's that eye roll and sigh, that you just can't stand, is it that you want them to say, yes, ma'am, or say, okay, I understand, or I heard you, thank you for explaining? What is it that you want them to do instead? Do you just want them to listen and comply without saying anything? Just acknowledge the direction and follow the direction. So what is that replacement behavior that you want them to do? Who is responsible for what? So who is responsible is excellent. Who is responsible for implementing the behavior plan? Who is responsible for delivering the rewards? Who's responsible for the antecedent interventions? Who's responsible for the consequent-based interventions? Is everyone responsible? Is mom responsible? Is dad responsible? Is grandma responsible? Is whoever's present responsible? Sometimes it can be a little bit confusing about who's in charge here. What are your antecedent interventions? So sitting down to write those things out, it helps to formalize those and to put it in writing, because then it makes it more concrete. So I do encourage, no matter what situation you're in, to write those things down. Are we going to do pre-teaching? Are we going to use timers? Are we going to use a schedule? So what are those things that we're going to be doing? Are we going to have a 10-minute talk time per day? If so, what time of day is that? When is it? Who's going to do it? So what are those antecedent interventions? What are the consequent-based interventions? So are we doing a token economy? Are we doing a level system? Are we doing timeout? Are we doing self-monitoring? What is that consequent intervention? Who's doing it? Who's responsible for it? When is it going to be? How do they earn tokens? So writing those things down. What are the emergency procedures? So if you have a child who engages in potentially dangerous behaviors, high levels of aggression, property destruction, what is your emergency plan? Your antecedent intervention and your consequent-based interventions, those are to reduce the likelihood of an emergency, but in the process of learning the new procedures, in the process of learning this, until that behavior is extinguished or a new behavior is learned, you need to have an emergency plan in place, a protocol for how do we handle severe aggression, how do we handle property destruction, at what point do we need to call for assistance, at what point in time, maybe, depending on the severity of behavior, do we need to send a child home? Do we need to call the parents? At what point in time do we need to call 911 or go to the emergency room? What is our emergency protocol? And make sure you have your function statement written into your behavior plan, because the function statement grounds you back to not what is the behavior, but what is the function, because that is so important. How do you regroup and how do you stay on track with we are focused on attention and rewarding with attention and managing our attention for the undesired behavior, and how do we stay focused on what the problem is, not what the presentation or the form of the behavior is. So having that function statement in your behavior plan actually helps keep you grounded. This is the conclusion of this series. I hope you have found it helpful. I hope you have learned something, and I hope you've gained some new knowledge to take home with you. Thank you.